Good morning friends. Today we will be discussing CKD, chronic kidney disease, and its association with pedal edema, where we will be discussing the signs and symptoms, causes and treatment of pedal edema. So first let's see what is chronic kidney disease. Chronic kidney disease is a condition where there is a continuing and permanent degeneration of kidneys, which results in loss of function of kidneys. Kidneys have a vital function in our body. They are involved in excretion of nitrogenous waste products. They maintain acid-base balance in the body and also give us two hormones which are used for production of RBCs and for bones. The chronic kidney disease is divided into 5 stages, but what is more important is stage 3 to 5. Stage 3 we say is chronic kidney disease stage 3 when the patients lose the GFR goes below 60 ml per minute, and we say stage 5 when the GFR goes below 15 ml per minute, and means that the patient now requires some form of renal replacement therapy in the form of dialysis or transplantation. Kidneys can compensate for lost function. So the signs and symptoms of chronic kidney disease or loss of kidney function appear quite late. They could be the signs and symptoms of lost kidney function could be either loss of appetite, nausea, vomiting, swelling of feet or face, decreased urination or increased urination, nocturia, and other symptoms could be like puffiness of face and disturbed sleep or dyspnea. Now we'll go on to discuss the pedal edema. What is actually pedal edema? Pedal edema is actually abnormal accumulation of fluid on the ankles and the feet. There could be various reasons for the pedal edema. The two major reasons for development of pedal edema in chronic kidney disease are either loss of protein in urine or abnormal kidney function. What happens because of loss of protein? Once kidneys start losing protein, it looks like the body is depleted of fluids and the kidneys start retaining salt and water, which results in abnormal accumulation of fluid in the dependent parts of the body, especially ankle and feet or legs. Then what can be done to mitigate this pedal edema? What we need to do is we need to restrict our water intake. We need to restrict our salt intake, which results in excess water reabsorption from the kidneys, and or we need to use some drugs which we call diuretics, which result in excretion of excess salt and water from the body, and some patients may also try compression stockings. So what happens actually with pedal edema? Their signs could be either there could be a swelling of the feet, or there could be retention of the pits on the skin. You can see after slight compression of the skin, or there could be shiny and loss of shiny skin with loss of hair. So for the treatment part, we need to look into, first of all, everybody needs to restrict its liquid intake. Once you have pedal edema, that means there is excess of fluid in your body and you need to restrict your intake for it. And then you need to restrict your salt intake because salt results in more absorption of water. So you need to restrict salt and processed food in your diet. Thirdly, you need to add, if all these measures still do not result in resolution of the pedal edema, then you can add drugs which we call diuretics, which result in excretion of excess water and salt from the body. But with excessive use of diuretics, sometimes patients may feel giddy or lightheadedness and may result in reduction of blood pressure. So it needs to be under the supervision of a doctor, and you need to take the prescribed dose as advised by your doctor. Some patients may try compression stockings. It needs to be appropriate size and fit. If they are not of appropriate size or fit, it may cause irritation of the feet. In the last point, what I would like to stress would be that, see, we all know that diabetes and hypertension are the most common causes worldwide, and all the patients need to be with such risk factors, like patients who are on regular use of NSAIDs or painkillers. Patients with other risk factors should be regularly tested. Patients should have good BP and diabetes control. and they also need to undergo regular physical activity to maintain a healthy lifestyle. And most important thing is prevention of chronic kidney disease rather than management of treatment of chronic disease. So we should be already focused on prevention of chronic kidney disease. Everybody might say that you should drink plenty of water for the prevention of chronic kidney disease. This is absolutely right for patients who have normal kidney function, but patients who develop some kind of pedal edema, then you need to understand that the fluid is accumulating in your body and you need to restrict your fluid intake. Thank you all.